We saw a grant from HRSA. Actually, this is our second grant from HRSA. Initially, we received one that focused on diabetes. And the reason it's so imperative that we do something in our area is because there's 35% more diabetes in our region. Diabetes is just such a disease that takes such it just takes a lot of toll on the individuals that have that. So, and that is the #1 disease that we see in our region, and so we sought a HRSA grant to help with that, and we've had great success with that grant. Our patients do not have uninsured insurance, or they're underinsured, so they don't have the simple access of being able to get in with a specialist. And if they did, they would have to travel. If that barrier was removed, they would have to drive an hour and a half to care. We've used the funding for several things. We had an informal consortium all along, working with different partners through the years. So we expanded our consortium partners. We've expanded our telemedicine capabilities to include wound care for the diabetics and retinal screenings. We did massive outreaches. We're responsible for the largest healthcare outreach in the United States, which is called Remote Area Medical, or RAM. And we also have used the grant money to facilitate our diabetics being able to see specialists. Everybody that comes to either our outreaches, our large outreaches like the largest medical outreach in the United States, the RAM clinic, or if they come through our stationary clinic or our mobile clinic, everyone gets screened for diabetes. We remove the barriers for these patients, and once we get them in with the endocrinologist, once we get them their diabetic supplies, once we get them their medication, once we get their education for them, their glucometers, when we remove all these barriers, then we see really good results, and we could not have done that without the help of the grant.